Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. Today's topic is home care during COVID-19. What exactly is home care? How do you pay for it? How do you choose a home care company? And is home care during COVID-19 a safe option? To help us answer those questions today is Kristi Campbell. She's the owner of the Home Instead Senior Care franchise located in Brandon. Kristi, thank you for joining us today.
Thank you for having me, Miss Patricia. It's good to see you.
Good to see you as well. Now, many families use home care as part of their long-term care plan, either to supplement or to take the place of family caregiving. What types of services are provided during home care, and what exactly is home care?
So home care ranges from as simple as transportation. So we would call it the Driving Miss Daisy, where we just simply assist with appointments and socialization and getting them involved in society, because typically the first thing they lose is their driver's license, and that can be quite the impact. So you have from the level of care where you just help with transportation all the way up to total care, in-home care, in bed-bound care, overnight care. It can run the gamut from something as simple as independence to something as all hands on deck, complete total care for a bed-bound patient.
And it's tailored to the individual, correct?
Yes, ma'am. Home care is based on each individual need. You assess the client's needs, you assess the family's needs, you assess the family's perception of what the client needs, because sometimes that's different. And then you assess what the budget is and how the ebb and flow is going to work. It can range. There's a specific event that you only help someone for that one moment, or there's a lifelong relationship. It really depends upon each case-by-case scenario.
Because I think some people, when they think of home care, they think of it as all-inclusive. But it could be just a few hours a week or a one-time event, as you said.
Correct. Yes, ma'am. It can be one and dones. It can be a quick bath visit a couple days a week. It could be 4 hours a day. It could be 24/7. The most important thing to realize is that the client and their families really drive what they're looking to succeed with, or what they're looking to plan together.
That's good to know. Now, there are many home care companies out there. How does someone go about choosing the correct home care company for them?
So you can hire your church friend down the road, you can hire an agency, you can hire someone off of Craigslist. You know, there's a gamut of all kinds of different options. I would look at the quality of the caregiver. I would look at the professionalism of the agency. I would look at their experience. I would ask a lot of questions. I would do some reference checking. I would do some background screening. The state of Florida has a licensing entity for those of us that are companies. If you're looking at a company, I would look at those licensing websites, which I believe you're going to be putting links on. But there are ways to screen, either if you're hiring the family friend down the road or if you're hiring a company. But I would look at quality, I would look at professionalism, and I would look at experience. And I would ask specific questions. What is your experience in Parkinson's? What is your experience in stroke? Whatever your loved one has been going through, I would ask whoever you're interviewing, what is your experience in this? What is your training in this? Get to know the quality, because the quality is going to be the deal breaker, so to speak. You can get someone that sits there on their phone and reacts when mom needs to lunch, or you can get a caregiver that is trained and has the experience to watch mom, cue mom, know what mom wants before mom knows what mom wants. So that quality and that experience is going to be the difference in what type of a care you're going to receive. And then that quality of care will affect if your mom ends up going to the hospital, not going to the hospital, declining, not declining. Quality is the number one thing that I always encourage adult children, family members, spouses, whoever is making the decision to pay attention to.
And it would be okay for the first visit for a family member to be present to observe that interaction.
Yes, ma'am.
And not just appropriate, but recommended probably.
Highly recommended, yes.
Kristi, how does someone go about paying for home care? Are there options?
There are options. You have the proverbial private pay or cash. You have Veterans Administration that has two programs under the VA. They have the Choice Program, where the VA sends a provider an authorization. So in the layman's world, picture an HMO insurance approval. That approval is what we call an authorization. Well, they'll pay for our care. And then also under VA, you have a thing called aid and attendance, where it is a reimbursement to the veteran for expenses that they incur by hiring a company. So you have that as a payment option. You have Florida Managed Medicaid as an option, where that's also an authorization-based income restriction program. There are home care companies that have contracts with the insurance companies that pay for our care. And then you have long-term care insurance policies. Back in the day, you would hear Penn Treaty. They're no longer around, but people remember that name. John Hancock, GE Financial, Bankers Life, those type of long-term care insurance policies that also pay for in-home care. Lastly, one of the newest ways for payment has been the Medicare Advantage plans. They're called Medicare Part C as in Charlie. They are dabbling in trying to figure out how to pay for home care. There's still some loopholes on that. They don't have all that worked through, but there are some opportunities on getting Medicare to pay under an Advantage plan.
Kristi, during COVID-19, a lot of people are going without care because they are concerned about someone coming into their home, and rightly so. What precautions are home care companies taking to make sure that their clients are safe?
So as an agency, it is my responsibility to protect my employees as much as it is to protect my clients and their families. So the first thing we did with all of our caregivers is provide all of their personal protection equipment, their PPE equipment. So everybody got their mask, everybody got gloves, everybody got face shields if they wanted them. I mean, we really ramped up on all of that equipment. In addition, we internally are testing our own caregivers. So we're not relying on the 3-hour wait at Raymond James Stadium for testing. We test internally. So something that you're going to want to ask any home care company is, do you do your own testing, or are you relying on the Department of Health testing? When you do your own, you control your testing frequency versus waiting for those endless results and those endless lines. The other thing is we wear a mask our entire shift. We have to protect the client and the caregiver. Now, there are concerns of hearing impaired clients. There are concerns with our dementia clients. And then when we have those scenarios, we are having the caregivers wear their mask when they are within their personal space doing the hands-on hygiene care. Otherwise, if they're 6 feet away, then they don't have their mask on. That way they can still have that eye recognition, either hearing, they can hear us without that mask, or the dementia clients recognizing us to the best of their ability. So there are a lot of monitoring going on. With every shift, our caregivers clock in and they're asked their 5 questions. Did you take your temperature today? What was your temperature when you took it? Have you been around anyone positive? Have you been traveling? Have you been exposed? And so we ask them their pre-shift questions on how they're feeling, so we're monitoring symptoms. So as agencies, we are all just as concerned that we don't get the client ill or the caregiver ill, and we do a lot of screening and a lot of questions. We also ask the family members, have you been exposed? Because when family members live with their senior, the seniors aren't going anywhere, but the family members have the potential for exposure. So we as an agency protect our clients as much as we protect our caregivers. And it's all about just paying attention to your symptoms and then wearing your mask and wearing your protective equipment.
So having home care during COVID-19 can be a safe option for people.
It can be a safe option. Yes, ma'am.
They need to do their homework and ask what is the agency doing to protect both their staff and their clients. And
correct.
It will help them know if it's a safe option for them.
And you can ask the agency, when your caregiver is exposed, what is your protocol? What are you going to do? How are you going to communicate to the family or to the client? Because if caregiver Kristi got exposed by client A and she goes to client B, how are we communicating to client B that caregiver Kristi got exposed to client A? What is the protocol? What is the process? What kind of conversations are being had? And just asking them, what are you going to do? And have those honest conversations.
And that's a good point for all the circumstances of home care. Ask questions. I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection.